So we're here today to talk about the PRP Rejuvenating Facial. Well, full disclosure, you've done it on me.
And you look beautiful.
Well, thank you. It was a while ago. We might have to redo it. But so it's also for it's for little lines, it's for resurfacing, it's for some deeper, for spots, right? Also for sort of uneven skin tone a little bit as well.
It works fantastic for those problems that one may encounter. A lot of that is due to sun damage as well. It can also be diet related, all right? So we have all various degrees of deep wrinkles, deep lines, sagging of the cheeks, sagging of the chin, underneath in the neck, even in the décolleté area, the necklace area.
Yep.
So there's varying degrees. There's resurfacing or microneedling that we can do over the entire surfaces that individuals would like to rejuvenate, and then we also can do spot treatments with platelet rich plasma.
And I think that's one of the things that's a little bit different about what we do with our treatment at Beverly Medical Center, right? So I've seen a lot of places where they do the microneedling, and we'll kind of walk through what that process is, but not every place does what you talked about, the deeper injections. And what's really the benefit of doing those injections over just the microneedling?
A lot of the benefit that we see with that is that we are actually taking that concentrated form of platelet-rich plasma, the PRP, we are actually injecting it or putting it into the difficult areas or areas that are very damaged. And as it's more in a concentrated form, can allow a little bit better healing.
So tell us a little bit more about what that does. So when you're injecting, so you've taken your own blood, you've sort of separated out and concentrated the growth factors, you inject it into an area of damage, what happens?
At that point, it will send out the little messengers, chemical messengers, and bring other cells to the area as well.
Okay.
And what it does is these cells that are in the platelet-rich plasma and the growth factors are now in an area that it's being told what it needs to do. It will help to rebuild some collagen. It will help to cause more
like cell turnover? Is that a safe thing to say, or what's happening with it? Yeah.
It will help to tighten.
Okay.
Spot tighten in those areas that have the deepest, say, of scars or deepest wrinkles, but it's a more concentrated area where collagen will be built.
Okay. Well, walk me through, and I've had this, but walk us all through. So what happens? So I come in for my appointment. Let's say we've already done the initial screening. I've already gotten the instructions, but I come in on the day itself. What happens?
On that day, we ask that you remove all makeup.
Okay.
Okay, so we're going to remove all makeup.
That's it. Okay.
And what I try and do is I try and make it like a spa visit, like a spa-like environment. We'll have beautiful, relaxing music. We have a nice table, warm blankets.
I remember the blankets.
Okay.
Yes.
And try and really quell any fears, because it can be a little intimidating sometimes.
Yep.
So we will allow for a nice relaxing environment. We use nice warm towels to open pores on the skin.
But tell me, can I back up 1 second though? Because first you have to actually, because unlike Botox or something artificial that we're injecting, you actually have to, it's using your own blood for it. So before we get into the relaxing part of it and the actual administration of it, there's that step as well, right?
Right. So upon coming to the facility for your procedure, what one can encounter, we encourage lots of water before you come in. You can come in having eaten. You don't have to be fasting. We're going to have our nurse draw your blood. So tubes of blood are taken. We will take that, we spin it.
And I got to see that. It was pretty cool to watch. So it comes out and it's not red anymore. That was the part that freaked me out. Yeah.
This will be separated. So we'll have the red blood cells on the bottom.
Yep.
We have white blood cells and platelet-rich plasma.
It's kind of yellow.
It's kind of yellow whitish, okay?
Yeah.
And then the other layer, the top layer, will be platelet pore. So we take that beautiful middle layer from what we have spun your blood down to. So after blood is taken and that whole process is beginning, then we begin the relaxation process and the spa-like.
Well, and the beauty of it though, the beauty of all that work that you mentioned is that we already know it's hypoallergenic. We already know it's compatible with you. It's not like injecting something artificial.
Right. Not like Botox, nope. Not like the chemical peels either. All right. We're not using any artificial chemicals for any type of peeling of the skin. There is no Botox, which can be toxic.
Or fillers, right? Which, not that there's anything wrong with those things, but this is for people who want a different approach.
Correct. The fillers are chemical. They can be very hypersensitive. They can cause allergies to occur in the areas that they're put. So none of that will occur with platelet-rich plasma. It's going back into you. Correct. It's you going back onto you, so there should not be any type of allergic reactions related to that whatsoever.
Well, that's nice. So we get the blood, you're in the relaxing stage, and then I think you mentioned that the first step once we cleanse everything is that we start with what you call microneedling. So for someone who doesn't know what that part is, what does the microneedling entail?
The microneedling, the instrument looks like a pen almost. On the tip of this pen are about 12 very microscopic thin needles.
Okay.
And the instrument itself vibrates. With the vibration, use of vibration and pressure as we sweep over the areas of the face and the neck and possibly décolleté if that's what someone is having done, it will cause microscopic holes within the skin.
Okay.
As we are performing this maneuver, we are also now layering the PRP onto
basically this.
Right, your own PRP onto the skin so that it will be absorbed through the microscopic needles.
And I can say before you did that, you applied a little bit of a numbing cream. So you don't,
correct.
I have to say you don't feel like, the term microneedling might be a little daunting. It doesn't feel like that. It's just sort of a light pressure. Maybe it doesn't hurt.
Correct, light pressure, just a little vibration.
Yep.
The instrument itself is a little loud, so I do have the music on, so that's kind of a distraction and relax. Doesn't take that long.
Yep.
Typically, the procedure itself, we cause a uniformity of microneedling to the face and neck and décolleté areas.
Okay, so we do the microneedling. So when that process is done, then you move on to the targeted injections.
Correct. Okay. And these can entail the crow's feet. It can entail around the mouth area. It definitely usually includes underneath the chin and the neck area. And also the necklace or the above the décolleté area. These are crucial areas that seem to thin as we get older. They tend to thin as our hormones also with perimenopause and menopause occur. Even in men go through
you've done,
decreasing hormones.
Absolutely. Facials on men as well.
Absolutely.
And
this is not just for women.
Yeah.
Absolutely. The male component, if a male is coming in for them as well, which are fantastic for them, they also, again, the wrinkling, sun damaged, or their hormones.
Yeah, they even some men take even less good care of their skin. They don't have as much sun protection on or things.
Absolutely. Okay. So that's the process. We'll use the spot injections. This is always discussed with the individual as well.
Yeah, it's not like you have a routine of everybody gets the same injections.
These are all individualized treatments.
Right.
Whether it be the microneedling to the face or neck or décolleté, even hands. We have done PRP injections to the back of the hands. This is also for aging and thinning of the skin as well. Okay. So that's an option, and that has produced great results with tightening of that area of the skin as well.
So I guess so I've had this experience too and a little bit of what to expect. So I think you're injecting something. So of course there's going to be a little bit of where you inject it, you can temporarily see it, like there's a little bit of puffing out of where you inject it. So sometimes people are like, is there any downtime? But that puffing out goes away. I mean, this is not like a days of downtime. The puffiness after the procedure goes away relatively quickly.
Correct. Downtime really is a misnomer, I will say. Typically, we ask that there not be any high exercise intensity, no going outdoors in sun. If you're going out to the outdoors in sun, must wear sunblock. Right. I know individuals may not like that feeling. Big hats to shield, okay? No saunas, no hot tubs. Showers are fine, baths are fine. Typically, within 24 hours, one can resume wearing makeup again if you wear makeup. There may be tiny bits of little bruising with the spot injections.
Where you injected,
These typically fade 3 to 5 days.
Well, in full disclosure, I don't know if you would approve, but after you finish my procedure. So there's a little bit of puffiness. There's like some smoothness and I think glow from the microneedling. So I threw on a baseball cap and went out to eat an hour later. So it's not one of those you have to hide in your house procedures.
Correct. Not typically. And typically there should not be any residual pain involved with this. The injections, the puffiness usually resolve very quickly, usually within 20, 30 minutes. So people resume activities. They go out to eat, go to the movies. I can recommend, exactly, just nothing with the high intensity or heat.
Or bright, and also bright sunlight.
Right, or bright sunlight, usually right after the procedure.
Well, and I will say there's two facets of this that I think are really cool. One is the microneedling, I think right away. So there is some immediate gratification. My skin was much smoother and glowy after the procedure, and that's kind of an immediate thing.
Correct. This procedure itself typically will see more immediate results, and you sort of touched on that element, and that is the brightening of the skin.
Right, that's great.
We really see this pretty quickly after the procedure. We will see a softening and smoothing of a lot of the wrinkles, typically right away or right after the procedure. The elements of the injections, the PRP injections and spot treatments, these work in a slower fashion, but as weeks evolve, 2 weeks to the 4th week to the 6th week, we can start to see definite softening in wrinkles in the wrinkled area.
Right? If you're rebuilding your own collagen, that's not something you walk out the door. We didn't just inject something. Your own body is rebuilding.
Right. This is one of the difference between a filler or Botox. It's not that immediate with our spot injections, but over time, it has built that collagen, and this is what will also, that matrix, that collagen, that tightening will last for a period of time. It is recommended, though, that we do more than just one, and typically on a time schedule.
What do you recommend? I know it must be different for each person, but what would be a typical regimen?
An average could be, we have done them as early as 8 weeks. It can be as long as 12 weeks. Typically, it would be best to have another one during that period of time. It builds upon itself. So we start that process of healing and collagen building and tightening, lessening of the wrinkles and brightening of the skin. As we have another treatment that's stacked upon that, that will now be boosted, like a booster, and that will continue even greater and longer.
Is there sort of a maintenance mode? Like once you've done that first series, do you recommend them every so often, or how does that work?
I would recommend it usually typically every 6 months. We kind of bring our cells back in, we perform the procedure again. We may not need as many spot injections at the time. We may need more, we may need different ones as well. But this maintenance helps continue that collagen to be built and to help the skin rejuvenate itself, cell turnover, cell rejuvenation, brightening of the skin, and lessening of scars. Once scars are lessened, they don't tend to come back.
Oh, that's a nice feature. I remember I talked to one of your other clients who had this, she has this done on a regular basis. I think she was one of the first patients to come in and do this type of a facial. And she mentioned she's sort of like me. She loves her products. She also loved the sun when she was younger, but she was saying how she's tried all the expensive products, but she's now sort of pared that down. She's found that doing these twice a year, that's pretty much good enough for her, and that's done more for her than the expensive products.
Correct. We also include products with the visit.
That's right,
So these will have a little care package, I call them. A little gift. It will include some vitamin C, vitamin E, and some all-natural moisturizing cream.
So both topical things and things that you would take, like supplements.
Correct. And some olive oil soap. These are imperative in the healing process and to continue the growth process and the rejuvenation that we want to achieve. They are imperative.
Well, I think that's another nice feature. So one thing that's, why would you do PRP? It's different than other more synthetic treatments, and also the way in which you do it is making sure the whole end-to-end process is most successful.
Correct. And we are here. We answer questions, whatever someone's not sure about. The maintenance, every 6 months, that's an individualized entity. Some, I do have a couple other patients who come in every 3 to 4 months, and they're beautiful. It's wonderful. Men, same thing can also be for men too as well.
Yeah. Well, I know, and we're not going to talk about it today, but I know we'll be talking about, as you discovered, as you were doing some of these more aesthetic treatments, you discovered another really good use of it for hair rejuvenation, which we'll talk about separately. But PRP is not just for the face, it also can be used for the scalp, and it also can be used in other areas of damage on the body, which we'll talk about separately, but it's a really useful strategy for all kinds of issues.